Did you know that getting up more than twice during the night to go to the bathroom could reduce your life expectancy by up to 3 years? Yes, you heard right. This habit that many consider normal for their age may be quietly sabotaging your health, your mood, and even your safety. Hi, my name is Dr. Alexander King, and for over 20 years, I've been helping people achieve a fuller and healthier life. Because aging well is a right, not a privilege. Just imagine, you're there, sound, asleep, dreaming of that dream vacation or reliving good memories, when suddenly, that pressure on your bladder. You resist for a few minutes, toss and turn, but there's no way around it. There you go, stumbling in the dark, tripping over furniture, risking a fall that could change your life forever. And the worst of all, when you get back to bed, sleep is gone. You lie there, tossing and turning, thinking about life until there's that urge again. It's a vicious cycle that leaves millions of people over 60 exhausted, irritable, and afraid to hydrate properly. But here's the good news. Getting up several times a night to urinate is not a life sentence of aging. This condition, technically called nocturia, affects about 80% of people over 65. But it can be managed and even eliminated with the right strategies. In the next few words, I'm going to share with you 4 natural and scientifically proven solutions that have transformed the sleep quality of thousands of people. Simple strategies, without expensive medications, without surgeries, just smart changes that respect the natural functioning of your body, because sleeping through the night shouldn't be a luxury, it should be your right. First solution, the smart hydration method. First of all, let's break a myth that may be ruining your nights. Stopping drinking liquids after 6 p.m. is not the solution. In fact, this can make your situation much worse. Let me explain why. Our body is like a smart sponge. During the day, when we're standing and walking, our tissues absorb liquids, especially in the legs and feet. That's why many people notice their legs get a little swollen at the end of the day. When we lie down, this reserve of liquids is released into circulation and, consequently, to the kidneys. The smart hydration strategy works like this. First, stay well hydrated during the day. Drink at least 50 to 65 ounces of water between 6 a.m. and 4 p.m. Yes, you read that right, until 4 p.m. This ensures that your body has all the necessary hydration without overloading the kidneys during the night. Here's a technique we learned from studies conducted in leading American universities. The 90-minute rule. Stop drinking any liquid at least 90 minutes before going to bed. But beware. If you feel thirsty, just wet your lips or rinse your mouth with water. This relieves the sensation without adding volume to the bladder. A valuable tip, elevate your legs for 30 minutes before bed. Sit in an armchair and put your feet on a stool or support. This helps those liquids accumulated in the legs during the day to return to circulation while you're still awake, reducing urine production during sleep. Have you ever tried raising your legs before bed? Have you noticed any difference in the frequency of bathroom trips? Share your experiences in the comments. I love hearing your stories and always learn a lot too. Second solution, the foods that irritate and those that soothe your bladder. Here's a secret that many doctors don't tell you. Some foods act as natural irritants of the bladder, tremendously increasing urine production at night. And you'd be surprised to know what they are. Caffeine is obvious, right? But did you know that it can stay in your system for up to 8 hours? So that afternoon coffee at 3 p.m. is still working on your bladder at 11 p.m. The same goes for black tea, sodas, and even chocolate. Yes, chocolate contains a small amount of caffeine. But the real villains are more subtle. Citrus fruits, for example, are acidic and can irritate the lining of the bladder. Tomato, especially in processed sauces, very spicy foods, and even artificial sweeteners can turn your night into a nightmare. Here's a true story. Mrs. Johnson, 68, had been getting up 5 times a night. We found that she drank a glass of orange juice with dinner every day for the vitamin C. When she stopped the juice and started eating the orange in the morning, the nighttime interruptions dropped to just 1 time per night. Now, bladder-friendly foods, non-citrus fruits like bananas and apples, dark leafy greens, lean proteins, and whole grains are fantastic. But the real champion is hibiscus tea. Yes, that reddish one. It has calming properties for the bladder and can be taken up to 2 hours before bed. A technique that works very well is the anti-nocturia dinner. Complex carbohydrates like sweet potatoes, lean protein, and cooked vegetables, mild seasonings like basil and rosemary. Avoid excess salt, as it makes the body retain more fluids. What foods have you noticed that worsen your nights? And which ones have you tried that helped? Let's create a collaborative list in the comments to help more people. Third solution, the magic position and strong bladder exercises. You'll be surprised by this discovery. The position in which we sleep can drastically influence how often we wake up to urinate. And no, I'm not just talking about sleeping with your head elevated. Recent studies show that sleeping slightly inclined to the left can improve venous return and reduce compression on the bladder. It's as if we give a helping hand for our organs to work more efficiently during the night. But here's the secret that changed the lives of hundreds of my patients: nighttime Kegel exercises. No, not those exercises you do during the day. These are special, done in bed before going to sleep. Lie down comfortably and contract the pelvic floor muscles, as if you were holding your urine, for 5 seconds, then relax for 10 seconds. Repeat this 10 times. What many people don't know is that these muscles, when strengthened, not only hold urine better, but also talk to the brain to reduce the feeling of false urgency. There's a fantastic technique called calm bladder breathing. While doing the Kegels, breathe deeply through your nose, inflating your belly, hold for 3 seconds, and release slowly through your mouth. This activates the parasympathetic nervous system, which calms all organs, including the bladder. Another effective method is gentle abdominal massage in clockwise circular motions for 2 minutes before bed. This stimulates digestion, improves local circulation, and can reduce pressure on the bladder. Have you tried specific bladder exercises? Have you noticed any difference in strength or control? Share your experiences. They can encourage others to try too. Fourth solution, the 30-minute ritual that changes everything. This last solution is a complete protocol that combines everything we've learned so far, plus some secrets that make all the difference. We call it the 30-minute ritual because that's exactly what it is, 30 minutes before bed that can transform your night's sleep. First, the double void. Go to the bathroom normally, wait 30 seconds, lean slightly forward, and try to urinate again. You'll be surprised how almost always a little more comes out. This ensures that the bladder is really empty before you lie down. Next, practice the progressive relaxation technique. Starting with your feet, tense and relax each muscle group, moving up to your head. This not only reduces stress, which can worsen nocturia, but also improves overall circulation. Here's a medical secret. Body temperature directly influences the production of antidiuretic hormone, which reduces urine formation at night. Take a lukewarm, not hot, shower 60 minutes before bed. The natural drop in temperature after the shower signals to the body that it's time to reduce urine production. The environment also matters. Dark room, use blackout curtains, temperature between 72 degrees Celsius, and a humidifier if the air is too dry. Dry air can irritate the urinary tract and worsen nocturia. A revolutionary technique is the redirected thought method. If you wake up needing to urinate before getting up, take 3 deep breaths and ask yourself, is it really urgent, or can I wait until morning? Often, the urge decreases just with this conscious questioning. For more resistant cases, there's an advanced technique, nighttime bladder training. If you normally get up at 2 a.m., set an alarm for 1:45 a.m. and go to the bathroom. The next night, try 1:30 a.m. and so on until you can sleep through the night. It's like training the bladder to last longer. Have you tried any bedtime rituals? What techniques worked or didn't work for you? Let's share knowledge in the comments. The warning signs that cannot be ignored. Although most cases of nocturia can be resolved with these natural strategies, it is essential to recognize when it's time to seek medical help. Some signs should not be ignored. If, in addition to getting up several times a night, you feel pain or burning when urinating, if the urine has a different color or smell, if there is blood, even if little, or if you feel abdominal or back pain, see a doctor immediately. These may be signs of urinary tract infection, prostate problems, or other conditions that need specific treatment. Another important warning. If the strategies I shared here don't bring improvement after 2 to 3 weeks of consistent practice, or if nocturia arose suddenly and is worsening rapidly, it's time for a more detailed medical evaluation. Remember, taking care of your health is an act of self-love and with those we love. Don't wait for the situation to get worse to seek help when needed. We have reached the end of a journey that I hope has been enlightening and hopeful for you. Let's do a quick summary of the 4 powerful solutions that can restore your peaceful nights. The first solution taught us about smart hydration, drinking properly during the day until 4 p.m., stopping 90 minutes before bed, and elevating the legs. To redistribute accumulated fluids, remember, adequate hydration is essential. The strategy is when and how to drink. The second solution revealed how food directly impacts our bladder, avoiding irritants such as late caffeine, citrus fruits, and very spicy foods at dinner, and embracing our allies such as hibiscus tea and the anti-nocturia dinner. Food is our medicine when used wisely. The third solution brought the power of specific exercises and correct posture. Nighttime Kegels combined with calm bladder breathing, sleeping slightly inclined to the left, and gentle abdominal massage. Our body has incredible wisdom when we guide it correctly. And the fourth solution, our complete 30-minute ritual. Double voiding, progressive relaxation, strategic lukewarm shower, optimized environment, and redirected thinking for moments of awakening. Small, consistent actions generate great transformations. But more important than all these techniques is understanding that you deserve to sleep well. You deserve to wake up rested, energized, without fear of leaving home or drinking water. You deserve to age with quality, autonomy, and dignity. Imagine what it will be like in a month, you sleeping soundly, waking up only once, or maybe not at all, during the night, feeling refreshed in the morning. Imagine having the energy to play with your grandkids, travel without worries, go back to that night class you always wanted. This transformation is within your reach. Don't let yourself be convinced that it's the age or that there's no way. Thousands of people have already proven that it is possible, and you can also be part of this positive statistic. Before I say goodbye, I want to make a special request. If this content has brought hope and valuable knowledge to you, share it with friends and family who also face this challenge. Sometimes information can completely change someone's life. Don't forget to subscribe to the channel for more content about healthy aging and click on the bell so you don't miss any tips. Your comments and experiences greatly enrich our content and help other people feel less alone on this journey. Always remember, aging is a privilege, and you deserve to live each year with health, joy, and nights of restful sleep. Until the next video, and may your nights be blessed with the rest you deserve. A big hug from Dr. Alexander King, and see you next time.